Hi, my name is Giorcelli, and this slideshow is about the effects of physical activity on cancer survival. The thesis of this research is exercising regularly should be recommended during and after cancer treatment to help the human body slow or even stop the spread of cancer, regain motor function, improve cognitive ability, and potentially improve the patient's emotional state. Start off this presentation by adding a little bit of background to what cancer is itself. By definition, cancer is the uncontrollable growth of abnormal cells in the human body. This can result in malignant growths or tumors that spread and grow over the course of time. Obviously, cancer is detrimental to the human body, especially when it's not addressed immediately. This disease has historically been viewed as an impossible problem with no sound resolution. Treatment processes can be very taxing on the human body, causing a multitude of minor to severe side effects. For example, these types of treatment often result in headaches, nausea, fatigue, vomiting, hearing loss, and hair loss. One example of this type of treatment is chemotherapy. Moving forward, I will provide a little bit of background as to different types of exercise. Physical activity is a form of preventative medicine that doctors regularly recommend to patients given the plethora of benefits resulting from the exercise. Different forms of physical activity can be performed to target different health aspects of the human body. For example, endurance training often requires the body to produce smaller amounts of energy over a longer period of time. This type of training includes running, swimming, walking, and playing sports. Strength training primarily includes weightlifting and resistance training. Obviously, there are different levels of intensity when it comes to training, but it is vital for humans to ensure they are regularly staying active to keep their bodies healthy and fit, as it will help with physical health and mental health, as it can aid with anxiety and depression. Now I will discuss some of the benefits of exercising after being diagnosed with cancer. Since physical activity is vital to the human body's performance, it would be assumed that exercise could benefit a patient's diagnosis with cancer. One study investigated the effects of physical activity on patients with promising results, and this study was conducted by Jennifer Burnett from the School of Human Kinetics at the University of Ottawa and affiliates from the Cancer Therapeutic Program at the Ottawa Hospital, where the results alluded to the fact that exercise could mitigate negative side effects commonly reported during post-treatment, such as musculoskeletal limitations, impaired cardiovascular system functioning, cancer-related fatigue, cognitive problems, anxiety, and depression. There have also been multiple other studies that share the same evidence. My last major point of discussion will be the potential drawbacks of exercising after being diagnosed with cancer. In contrast to studies showing the support of physical activity as a treatment for cancer patients, there are also arguments against it. Some doctors do not suggest this method of treatment because the evidence is not certain, but more importantly, because the doctor cannot control whether or not the patient will actually follow through with the exercises. And, although the risks of increased physical activity in cancer patients and survivors have not been clearly defined, it can be expected to include musculoskeletal injuries and potentially small increased risk in sudden death with vigorous exercise and serious accidents with some sports. Additional arguments are cited as weaknesses in the experimental design of the research studies that have investigated the effects of physical activity on cancer patients. For example, some studies were found to be simply correlations, not causations. Some studies just have a multitude of confounding variables that make the results unclear as to where they resulted from. In conclusion, it is likely beneficial to perform activity after being diagnosed with cancer, but the dangers are not necessarily known. Multiple studies show that there is evidence that may point towards the fact that it is healthy, but the risks have no research, and there is still a large portion of gray area when considering this method of recovery. My sources for the presentation.